Hey guys, welcome back to Kid Medic, and today I will be teaching you how to draw medication up from a training vial and how to properly give an intramuscular injection. Alright, so the first thing you want to start off after you've performed hand hygiene is we want to go ahead and glove up. And remember, we're practicing sterile and aseptic technique, so you want to glove up the right way. I'm just going to go ahead and move all of our supplies so we can get a better view of this. So, injection sites are usually on the elbow or near the, not the elbow, the shoulder, and they normally go down into the epidermis layer, not the epidermis, they usually go into the dermis layer or the subcutaneous fat. So I have an insulin syringe, a normal syringe, and just a 10 ml syringe in case we need it. So the first thing you're always going to want to start to do is we're going to want to disinfect that site. So for 30 seconds, we're going to clean this site for 30 seconds. Our injection site, all around in a circular motion. Now most people don't clean it for 30 seconds, but it's what you're supposed to do. Alright, so we're just going to leave it at that. So what you really want to do is you want to let that dry, because if you don't let that dry, your needle is going to be pushing into the patient, and it's going to be pushing out isopropyl alcohol, and it's going to make it sting and make the experience a lot worse. So now, opening the syringe. The way to open the syringe is you're going to pop it. Like that. And we're not gonna, there's things we're not gonna want to touch on the syringe, which is like that little part right there. We're only gonna want to grab right there, not right there. So I'm gonna set down our syringe, and then I'm gonna take another alcohol wipe. I'm gonna take the vial I'm injecting out of. 1, 2. I'm gonna clean the top, let that dry. I'm gonna carefully take my syringe out. Not touching that area, and if the needle's screwed off, go ahead and screw the needle back in. That happens sometimes. So now I have my syringe. So we have the needle and the syringe pump. So this is a 3 ml syringe. I'm gonna go ahead and I'm gonna draw in a little bit of air into that syringe, just a little bit. And when I inject the vial, I'll move the arm. I'm going to be going holding it like this. Let me make sure y'all can see that. I'm going to be holding it like this. Checking the medication, making sure I have the right medication, checking the expiry date. And this is a training vial, so it does not have an expiry date. And we're going to go in like that. And once I have the needle in, I'm going to push in my air. And this will allow for it to better come out. So I'm just going to go ahead and say we need 2 ml. And I'm still trying not to touch, it requires me some practice, not to try and touch that sterile area that we talked about. So you also always want to drop a little bit more than 2 mils, like maybe 2.1 mils, just so we can go ahead, get the air bubbles out. So I'm going to go ahead and thump my syringe. There we go. So we have about 2 there. And now I'm going to go ahead and give the injection. So for an intramuscular injection, I'm not going like this. I'm not holding my syringe like this. I'm not going like that. I'm not going at any angle except a 90 degrees. So I'm going to go ahead, I'm going to hold my syringe. And I'm going to go at a 90-degree angle. I'm going to inject and remove the syringe, and I will dispose of that. And then you may want to put a band-aid on there or anything. That's basically how to give an intramuscular injection. So now let's walk through it with this insulin syringe. Insulin syringes are maybe different, and this is like a plastic training case, so I'm going to cut this open. So insulin syringes are different. They have this little guard, so you're going to want to take off that guard. And you're not really going to use this to ever drop from a vial because it's not good, so I'm just going to use a small vial. Remember, we take our alcohol wipe, 1, 2, cleanse our area. I take my thing, draw out my air. Let's say we need 30 units of insulin. Take that, place it in here in my training vial, push in the air. Extract a couple units. Sorry if you guys can't see this. Let's say we need 30 units. There we go. I'm going to take it. And insulin syringes may be in the leg, I believe, or in the arm. So I'm just going to go ahead and just show you how to inject this. Just go 90 degrees. In. Done. So that's for the insulin syringe, and I'm going to keep these needles to continue training with them because I'm not using these on humans. Normally, if these were used on a human, you're going to want to biohazard discard them. And that's really pretty much it. So that's basically how we're going to give an intramuscular injection, and I will be redoing my IV video. I just need to buy some more IV catheters. But yeah, that's basically it. So apply Band-Aid on it, and then you're good. I thank you guys for watching, and see you in the next video.